he's kind of the hometown celebrity here because he went to, he was sitting in these shoes. In fact, do you remember, did you guys have your
We certainly did.
the pre-med meetings right here in the spot?
We didn't have any cool shirts.
You didn't? Well, you know why. I put those together.
Yeah, you've done well. Yeah.
I'm just kidding. I really didn't. I kind of lobbied for it. I felt like we needed something a little more professional. But yeah, you remember sitting in these chairs?
You bet. You bet.
Yeah. So he went, he did his undergrad here, and then he, which I'll let him tell you about that, but then did his medical school at the University of Utah, which, as we all know, that's difficult to get into. And then did his residency at McCady. So I don't know of any way that you could keep it more close to home than what he did. So hopefully he'll share some of his secrets with us. So with that, we'll turn the time over to you.
Sure.
Okay.
Secrets are just being boring. It was certainly not the plan to stay so close to home, but it just kind of happened. So, well, first of all, yeah, just a little bit about myself. Thanks for the opportunity. I actually participated in one of these just maybe a year or a year and a half ago here. When I was a resident at McCady, the three of us came up. I don't know if any of you were here in that meeting. Oh, okay, yeah. So
Who else was with you?
Dr. Ardema, and I think Ashley Wentworth.
Cassie Whittier.
Oh, it was Cassie Whittier, that's right, yeah, that's right. Because all three of us went here to Weber and then went to the U. So yeah, so I grew up in the Salt Lake area. I moved to Morgan when I was in high school. Graduated from Morgan High Trojan. I loved Morgan, and so I decided to go back and practice there, and that's where I am now, doing family practice. I went on an LDS mission after high school, and then came here to Weber State. I wasn't 100% sure what I wanted to do straight out of the gates. And so I was just taking kind of general classes and stuff. One of the classes that we had to take, and you know, people say, what's your story? Why did you go into medicine? Blah, blah, blah. And this is, you know, you can say, well, I had this great experience where I was an EMT, and I said, this is what I want to do, you know, pumping on somebody's chest, you know. But it was actually not quite so sort of dramatic. I took I don't know if you still have to, but they had at that time Introduction to the University. It was a 1 credit hour class, and just once a week, and down in the social science building. And as part of that, you had to take a personality test that was supposed to tell you what your career should be. And so I took that personality test, and it told me I should be one of two things, either a dentist or a school bus driver. And so I said, well, dentists make more money, that's what I'll do. And so then I started taking science classes and liked them and stuff. And I was getting all ready to take the DAT. And as part of it, you know, you try to get any type of medical exposure that you can get. And so I got my EMT, and I was a volunteer on the ambulance in Morgan County. And eventually that led to getting into McCady, and I worked in the ER and in the operating room. I tried to get into some dental offices to be a dental assistant, and everybody looked at me like I was crazy because that was a girl's job, right? And you have to be a young girl to do that, and apparently, because I was rejected everywhere I applied. And so I was getting ready to take the DAT, and I thought that eventually I would want to come back to this area no matter where I went. For schooling and stuff, and I was studying for the DAT. I was about to take it, and I went on a drive on Harrison Boulevard from the beginning to the end of Harrison Boulevard, and I counted the number of dentist offices as I was on that drive, and I don't remember what the number was, but that day I decided I couldn't do dentistry and still live here, and so I switched to medicine. I was working in the OR at that time. I was loving surgery. And I thought that 100% I'm going to be an orthopedic surgeon, and went to medical school, and your mind changes 50 times. And anyway, ended up in family medicine, which is something I thought I would never do, but I really like it. I got a bunch of, from Christian, I got a bunch of talking points, so we can have some sort of structure, but really I'd like to make this real informal. If you have questions, shout them out, interrupt me, and we'll just mostly just address your questions of anything that you have. Go ahead.
I actually have a question for you just about your undergrad. How many years did your undergrad take?
It took me 5. Yeah, 5 years. Because the first year, I kind of wasn't sure what I wanted to do, and then when I decided to be a dentist, I knew I didn't have to graduate, and so I just took all the pre-dental classes, which were also the same as pre-medical classes. But then, because at that time dental schools, less than half of them required that you had a bachelor's degree to matriculate there, and so I think more of them do now. But and so I wasn't as concerned with taking 15, 18 credit hours a semester kind of thing, and just kind of scooted by with the 12 credit hours so I could get better grades. And then when I decided to go into medicine, I had to take more classes and stuff, and so it took me an extra year.
Did you go summers?
I did, yeah, not every summer, but several of them. Yeah, I think summer's a great way to just get things over with, things that you're not looking forward to. A lot of the pre-med experience is preparing you for the medical school experience, which is just painful. And so, not just, but there's a lot of hoops, and that does not stop when you get out of your undergrad. And so just jumping through hoops is a big part of life in general, no matter what career you're going to. And so just getting those hoops and jumping through as fast as you can during summers is a great way to go. Things that you're not looking forward to doing, just get it over with as fast as you can. Yeah?
Maybe a little off topic. How did you do your EMT? Did you do it through your state?
No, I did it through just a little private company in Kaysville. My buddy had just done it through them. He had a good experience, and so I did it too. And it takes like 2 months. It's not a big deal to get an EMT basic, but it's actually a great way to get your foot into the medical environment. Being from Morgan, I was able to volunteer on the ambulance. It's not hard to do. To actually get a job as an EMT is tough, in like a department or something, like Ogden's or something. But in Morgan, you could just volunteer, and so mostly, I didn't have help from my parents and stuff to pay for school, so I had a couple jobs, and I volunteered on the ambulance at nights. So I worked a lot, and that's another reason I didn't take as high, as many courses, and it took me a little longer to get through undergrad. But it's a great way to get some experience, and then it opened up a door to work in the hospital, which was really, I think, the best experience I had. It kind of shored up that, yeah, I could survive in medicine, and I would actually like to do medicine.
So did you work as a surgical tech, or what did you do?
Yeah, my official title was core tech,
Okay.
which was gopher. We'd get all the little the surgical equipment ready before the surgery, and then if they needed stuff during the surgery, we'd run out because we weren't sterile, and we'd run out and get it and come back. But it was great because I got a good rapport with the surgeons and the anesthesiologists. I could go in and sit and watch any surgery I wanted at any time, and then I met a lot of them, and the anesthesiologists actually have time to talk to you, and so you get to know them well, and they got good letters of recommendation, which I think helped, yeah, because my grades weren't bad, but they weren't stellar, so the experience helped, yeah.
I think it'd be interesting, since we're all kind of approaching that time period, to hear a little bit about that time frame from when you decided, okay, I'm not going to take the DAT, what you did, then when you took the MCAT, maybe some of the hurdles that you faced from that point into getting into the U.
Yeah, so I guess, that is a good leading into the application process, and so it may be better to explain it from just, application process is not as complicated as we all think. You have to meet their minimum requirements, whatever those are, So they usually have a minimum requirement for GPA, and then the better GPA, the better, you know. But they'll set a minimum requirement, whatever that is, and every school's different. Second thing that gets you into medical school is all the little hoops that you have to jump through. The required classes, the service, the shadowing. Use your shadowing as an opportunity to get a letter of recommendation. That's what it's for. Because you'll need a couple letters from doctors. And so as long as you've met kind of those base requirements, it boils down to your MCAT score, your GPA, and your interview. And so those are the big important things in applying to medical school. So as you're at that point where you're going to start getting your resume together to apply, that's what you have to remember. And that's kind of from the DAT to the time I went to medical school. That's just what I did. You know, I would, Weber State's great, and we have small class sizes. I knew my professors, so it was not hard to get letters of recommendation from them. I did kind of a cheesy research project with Dr. Zeveloff, where it wasn't cheesy, it was kind of weird but fun. I mapped river otter populations in the state of Utah. And it was great because I made a presentation, I had an abstract on my application that I wrote. Zeveloff actually got to take my research and present it at a big conference in Japan. And so that looked good. And the state of Utah used, the Division of Wildlife used my research to make maps and stuff for their stuff. And so it all looked good. It wasn't hard to do. It didn't take a long time. I didn't have to spend tons and tons of hours doing it. It was mostly just looking through old books at where people had cited river otters in Utah, and just compiling it. And so it wasn't a hard thing. So you don't have to do hard things. It's just you get some good things that you can then talk up and make it sound better than it really is. and so those are just some of the hoops. And that's kind of yeah. I hope that answers. Does that answer your question?
Oh yeah, I mean,
yeah.
you know, that period is such a complicated time, and I
Yeah.
think one of the biggest things that we've talked about
Yeah.
is how you juggle and maintain that balance, you know, because GPA is so important.
Yeah.
Yet they stress the extracurriculars,
Yeah.
and so you know your focus is going back and forth.
Yeah. The extracurriculars are awesome,
Uh-huh.
and they make your resume look good. They don't have to be complicated. They just have to be there, and they have to make you look like a well-rounded person, and a person who can handle leadership positions and stuff. I mean, that's what they do. It's a checklist. And you have to be able to talk about it, and you make it sound better than it actually was. And then it comes down to the three big things. Do you do well in your interview? And to do that, you just got to be natural and just be yourself, and just chat with them and make them like you, just like any person, like you'd sell somebody something or whatever. If you try to take control of the conversation and show how awesome you are, it won't go well. You just talk to them and you just be a nice person, and they'll like you, and then they give you a higher score. And then you do well in your MCAT, which is a big strategy in and of itself, and then just keep your grades good, and you'll do just fine. Yeah.
So that was my question, is kind of specifically about the MCAT and what was going on in your life when you were preparing for that. As far as, were you taking a lot of credit hours? Were you still trying to do your extracurricular? Because in my shoes, I'm trying to do all of that at the same time, which I know there's other of us here that are doing that. And so there definitely gets that point where you go, there's only 24 hours a day, and I can either study for my physics test, or I can study for the MCAT, or I can, you know what I mean? And you just have to kind of decide. So I'm curious if you were trying to juggle all that, or if you spread it out a little bit further so that you could just study for the MCAT and you weren't taking any classes at the time, or that type of
So I did both, actually, because I took the MCAT twice. The first time I bombed it, And the first time I took it, it was over the summer. I just studied my guts out the whole summer, took it and bombed it. And then the second time I
See,
did
we
it.
love to hear that.
Yeah,
You know we love to hear
yeah,
that.
because it was, they only offered it twice a year at that point. It was either, I think it was August or April. And so I was like, oh, I'm gonna nail this thing. I spent the whole summer, because I did the same thing for the DAT that I didn't take. And I didn't do well. And it's because the MCAT, first thing you need to know about the MCAT is it's a strategy test. And it is not the hardest test that you'll take in your career, and it is not the longest, but it's the same strategy. You know, once you get into medical school, there are a series of board exams that you have to pass that are much more difficult and much longer. But it's a strategy of test taking. And once you figure out the strategy of test taking, this type of test, standardized test, you cannot know the answer, and you can always narrow it down to two choices, without knowing anything about the answer. Two choices. There's always a throwaway question, there's always an "eh" question, and then there are two questions in the answer stem that one is right and one is wrong based on which is more applicable to the question stem. That's it. And so once you figure out that test-taking strategy, these tests become much more doable. And so the first time I took it, I didn't figure out that strategy. The second time I took it, I didn't totally figure out the strategy, but a lot better. And it's because I took a course the second time. So I would recommend taking a test course, like Kaplan or something. I took Kaplan. Well worth your time, well worth your money. And I had a full semester. I had hard classes. I think I was doing OChem at that time. It was a very stressful semester. But
Were you married at that time?
I didn't get married until just right before medical school. So yeah, so it was just me. But that made things easier time-wise anyway. Yeah, so it's all about strategy. And so you just got to figure out that strategy, and you'll do just fine on the test. It's a strategy test. It's not what you know. It's how you take that test. I mean, it is what you know to a point, but it's how you take the test. Go ahead.
I was wondering about Morgan, is that considered a rural area so did you go through a rural, I'm not sure exactly how that pans out for the rural medicine sort of thing.
It totally depends. So Morgan is an interesting rural medicine place in that we don't have a little hospital up there. I don't staff an ER. I don't do deliveries. And so Morgan is unique in that way, but it's still considered rural, and it is in a lot of ways. I mean, I have people come into my office with shoulder dislocations and stitches and all sorts of stuff that I wouldn't have in a family practice here along the Wasatch Front. So, and then if you're interested in rural medicine, family practice is probably the best area of medicine to go into, because you get kind of a good mix of everything, and then picking a good program that offers a lot of rural stuff. And then they have big benefits. Morgan, unfortunately, doesn't qualify, but big financial benefits for real rural communities. They have loan reimbursement through the government. It's $30,000 a year, so that's pretty nice. And which I don't get, darn it. I applied for it, but they rejected me.
Is that because of Morgan then? They're saying it's kind of like it's...
Yeah, and actually the area qualifies, but the clinic does not, because it's a for-profit clinic, and you have to have a sliding scale fee. And there's just a whole load of requirements. And you can't bank on that money because there are this many loans available and this many applications for those loans. And so even the people that totally qualify, very underserved areas, won't get it. And so that's something you can negotiate with your potential employer and say, I will come, but if I don't get this money, will you subsidize me in some way? You know, maybe increase my pay, or you pay those loans. And some companies will do that. That's a whole lecture in and of itself. Probably something you don't need to worry about. But the art of negotiation when it comes to contracts, because they want you there, and so you have a lot of leverage. So, good question. Yeah.
As someone who's interested in primary care, I was wondering what's the biggest difference between internal medicine and family medicine? Because I know they're quite similar, but family medicine can do a couple more procedures than internal medicine. So I was wondering what's the biggest difference between them?
Yeah, the biggest difference is the age. So family practice does pediatrics, internal medicine does not. That's probably the biggest difference. The second biggest difference is family practice, you get trained in obstetrics as well, and internal medicine you do not. If you think you might want to specialize, then you probably want to do internal medicine or pediatrics or something, because those launch into specialties like gastroenterology, cardiology, rheumatology, stuff like that, much easier than family practice. In fact, family practice for most of those is not, it's not an option. And it's based on, in family medicine, ICU care is not as stressed. We have to do a couple months of ICU care in residency, but in internal medicine you do much more ICU care and learn how to run ventilators and all that stuff. And so they, because a lot of those specialties have intensive care type situations, that we have to actually manage that rather than, in family medicine it's like, it's more ER stuff, so you get them stabilized and then ship rather than manage it. Yeah. Good questions. Yeah. Any other? Go ahead.
So, did you get in your first time when you applied to the
Yeah.
Did
Yeah. The very last acceptance.
Wow.
Series, yeah. So they have a series of letters they send out because not everyone who gets accepted goes there, and they'll get accepted elsewhere and they'll go somewhere else. And so then, based on how many acceptances they have, then they send out another little volley and another one. And I must have been right on just hanging on the bottom of the rung, and just got it. It's kind of like this right here. If you meet their minimum requirements and you have a good interview, they put your name in the hat, and then they just kind of draw it out and say, Wyatt West. And it's serious. Because there's people that had much better resumes that didn't get into the U, that wanted to go there than I did. So from this school. So who knows? Who knows? It's kind of a crapshoot.
So I'm interested to hear just a little bit. You said that you were sure you wanted to be an orthopedic surgeon.
Yeah.
We're told, of course, don't be misleading, but there's such a need for primary care that in your interviews and your application express interest in primary care, right?
Yeah.
Was that the case for you? Were you up front, I want to be ortho, or how'd that go?
Yeah, you know what? I don't remember them talking to me much about it, to tell you the truth. And in my in my letter, or whatever you call the letter you have to write, personal statement, I wrote all about my experience in the operating room, and all these cool surgeries I love to watch and stuff. And so they knew I was kind of interested in surgery, and I didn't end up doing it. But and I think they know that. I mean, so when you go to an interview, you are going to be interviewing with, well, most of my interviews it was 2 or 3 people, and always a student, a 4th-year student, and the one that I interviewed with, I was familiar with. Her name is Melissa Bentley. She went here, and now she's internal medicine over at Ogden Regional, and so I interviewed with her, and then at the U. And then they interview you with a few faculty members, which are all physicians. And so they've all been in your shoes, and they know that you don't totally know, and that you're going to change your mind. And so I think it's much more, are you interested in medicine? Are you committed to medicine? And do you have a personality that'll get along with people? And I think that's mostly what they're looking for. So I had a few interviews where they ask you that. One was I was interviewing with one of the faculty that taught in the medical school, but he was not a doctor, he was a PhD. He was a doctor, but of like, I don't remember what his specialty was. And he got into all sorts of ethical questions. What do you think about euthanasia? and think I didn't have good answers for them. And I still got on their waiting list. And I turned them down as soon as I got into the U because their tuition was like over double.
Where was that?
In Albany College in New York. And Albany is a cool place. I would have loved to live there, but their tuition was pretty high, pretty hefty. Anyway, so it's funny. It's kind of a, sometimes it's just the luck of the draw who you get if somebody's in a bad mood. If you can make them in a good mood, then make them laugh or something. Then maybe it'll be a bonus actually.
How long did the interview last?
I think it was 15 or 20 minutes.
And there's more
in
than
each
one,
interview.
or there's?
Several. Yeah, there was several.
Okay.
Yeah, with different people. I never had a panel interview. I've heard of some people, they stand up before 6 people and they start firing questions at you. And that sounds, I wouldn't want to go there. I'd be like, this is going to be what my education's like. No way, I'm going somewhere else. So, but maybe some people thrive off of that. Yeah, good questions. Yeah.
Another question about the University of Utah. I'm curious to know your comparison of your workload there compared to your upper division undergraduate stuff when you're taking OChem. I mean, a lot of people in this room are doing OChem and physics and some other upper division stuff that I don't know if you remember, but it's pretty intense. I mean, there definitely gets to the point where you're like, I can't study enough.
Yeah.
I can't. Every moment, I feel like I should be studying more.
Yeah.
How do you compare that to your time at the U?
Same. Nah. It's a little different in that usually they try to coordinate a little bit better what subjects you're studying, and so you're learning. The first year is much like undergrad, and it's kind of fast and furious, a lot faster than any of the classes here. Right? But I wasn't working, and so it was my job to be a student, and so that made a big difference. It had less going on. So medical school, I would say, was the first 2 years a little easier to balance than undergrad, I think, just because I had less going on, because I wasn't working. But the material was much more. It's kind of, some people call it drinking out of a fire hose, and so that's kind of what it is. But it's just all part of the process, because medicine is very high pressure. It's a very high pressure field, and it gets higher pressure through each step. And so you just have to kind of get used to that pressure. And if you just don't like it, maybe medicine's not the right field. Because my life now is less hours but more stress than it was in residency. Residency was lots of hours and lots of stress, more so than medical school. Medical school is more stressful than undergrad. And it's just kind of more so. There's a saying in medicine, it usually involves a swear word, but so I won't say it. But poo-poo rolls uphill in medicine, is what they say. And so meaning the higher level you are, the more poo-poo you get. Go ahead.
Can you give an idea of what an average study load was for a daily basis or a weekly basis when you were in medical school?
In medical school?
Yeah.
We had classes, at least when I was there, they've changed the curriculum a lot, but we had classes from 8 until noon, and we ate a little lunch as we started to study, and studied until bedtime, every day, and weekends, kind of that way. Yeah. So that's why you can't work. I know some people who worked, but boy, it was tough. And there's some crazy people that eventually all go into neurosurgery that work overnight and then go to medical school and then study and work overnight. And those are crazy people. And neurosurgery is a perfect field for them. Yeah. Anything else? Yeah.
So I came to the Ogden Medical Surgical Society over the summer, and you presented a research project. So did you do research during medical school
residency.
And residency,
yeah,
or just during
both.
residency?
Yeah, both. Yeah, there's opportunities to do research all the way through, and actually, if I wanted to do research now, there's opportunities but I would get paid for it, and handsomely sometimes, especially drug research. But I don't do any of those because I don't feel like I should. I don't feel like it's totally ethical to use my patients as guinea pigs. But I should be their advocate, not the drug company's advocate, kind of thing. But some doctors don't feel that way, and that's fine. I don't fault them for it. And they do make a lot of money on research. But yeah, I didn't do like research isn't a big interest of mine, and I mean it's fun, it's fine, but it's not what I love to do in my spare time. And so, but yeah, did research in undergrad. In medical school, there's always tons of research projects because whatever medical school you go to, it will be unless it's a DO school, and I can't speak for them. Maybe it's the same way. These are research-driven universities. And so all the professors there and all the doctors there have research requirements to keep their job. And they have to publish so many papers. And so they are always looking for research slaves. And so there is a plenitude of opportunity. Yeah.
Don't a lot of schools have a research requirement?
Yeah, and there's some actually that, like Case Western University in Ohio, yeah, they actually do a 5-year medical school and 1 year is a research year. And that's great if you want to go into something really competitive, like orthopedics or ophtho or plastic surgery or things like that, because having a lot of research credentials really boosts your application for residency. And so, or if you do an MD, PhD. And the MD, PhD programs are much harder to get into. And your medical school becomes 5 or 6 or 7 years. But if you think you want to do something highly competitive, that's a great way to go. Great way. And they pay for your school, and they pay you on your in-school. So your loans, when you get out, are significantly lower because you're considered a professor.
And that's for the MD, PhD?
MD, PhD.
I didn't know that.
Yeah, you're an employee of the university. And so it's a great way to go. Because, I really didn't think about the loan thing very much. I just was like, everybody does it, and I'll be rich when I get done, and I'll be an orthopedic surgeon, making $50,000 a month, and no, loans, no problem. And now I'm discovering how very real loans are, and how much they hamper your lifestyle for a long time. And so the less loans you have, the better. Oh, absolutely. Oh boy. Yeah. So if you're thinking about doing the military, they do the same thing. They give you a stipend. Military residencies pay a little bit more than civilian residencies, and you're an officer, and so you get lots of benefits, and then they pay for your school. And then a lot of times, if you decide to practice for the military, I actually looked into this because I thought it would be way cool to be a flight surgeon. There's a flight surgeon that I did. He's a family practice guy. He just got out. His name's Jake Murdoch, and he's practicing in Logan now, I think, or Salt Lake. I can't remember. Anyway, I would do Instacare shifts with him, moonlighting, and he was moonlighting too because military doctors make a lot less. But he was a flight surgeon at Hill Air Force Base, so his schedule was 3 days of clinic, which you're taking care of young, healthy people, so not hard, and a half day of administrative work, which is do your notes, and you probably have some project you're supposed to do, and then an 8-hour day of flying F-16s. And that seemed like a cool life to me. So I thought about that and looked into it. And to get a job with the Air Force is what I looked at mostly, and to become a flight surgeon and stuff, it really wasn't that much more training, and they pay okay, and they give you like $180,000 to sign on bonus or something like that. So almost enough to pay for my student loans. Yeah.
So talking about student loans, if you could change it in any way, would you?
That's a tough question. I've asked myself that a lot. I didn't become a flight surgeon because I just was not interested in living a military lifestyle and moving a lot and being deployed. And so the military wasn't for me. And so no, I wouldn't have changed that. And then MD, PhD, that's a long time to go to medical school. And a lot of pressure, actually. More pressure than I wanted. And so I decided no. And I'm fine with what I've done. I'll pay off my student loans. I'll be fine. But it'll just take me a long time. Yeah.
So you said you work less hours, but you have more stress. So what is your schedule like typically?
I work 4 days a week.
Okay.
Technically 8-hour days, but in reality about 11-hour days. And then I take one 24-hour shift of call during a week, each week, and one weekend of 72 hours of call a month
And
at the Ogden Regional Hospital.
are those required or are those just kind of additional things?
It's kind of required. I mean, not totally, but you will take call no matter what physician profession you're in, and so that was the call group that I joined. That's what they did. And some call is nice in that you get paid for being on call. I don't get paid for being on call, which is kind of crappy. And if I do have to go do an admission, I live in Morgan, I practice in Morgan, so I have to drive from Morgan to Ogden, which is half an hour, and then back, so that's an hour. And then it takes always an hour and a half or so to do an admission. Some people are a little faster, but that's probably average, hour to hour and a half. So that's 2.5 hours, and I make like $80 to do that. And so it's really not worth my time, money-wise. But the other option would be to be taking lots and lots of phone calls from patients, and I've done plenty of that.
So is it kind of like on a contract basis, like you said with this call group? So are there like different groups that, so do you
Totally
have, like,
depends on what group you join.
so do you have like a term when like that group ends and then you could like pick a different sort of?
There's no contract, I could drop it at any time,
Oh.
but I would have to go into a different call group because someone needs to cover my patients too.
Right.
You know, and I'm not going to just cover my patients by myself because then I would be on call every day, all day, and every weekend. And so, which OBs do a lot, and you know other people do. So I mean, it's not like people don't do that, but I don't want to do that. And so I picked this call group because there was a tradition that we shared call with our clinic and their clinic, and that's just the way they do things. And so that's a big part of looking for a job too. Is you need to like your lifestyle, or you won't like your job. And so finding a lifestyle that you enjoy is very important. So if you like, I really want to practice in a real small town, I think that'd be so great because I love small town living, and I do. But I just don't want to cover the ER a couple nights a week and a couple weekends a month, and I just don't want to do a bunch of OB. Well, probably small town isn't for you, you know. So it's kind of, yeah. Yeah.
So where does the stress come in? So you're stressed.
The stress is that you take care of people, and people are demanding, and people get sick, and then there's you. So when I was in residency, it was stressful because I didn't know what I was doing, but I always had someone right behind me who did know better what they were doing, and now I don't. And so if I run into a problem I don't know what to do, that's stressful, you know, and especially if somebody's having big problems. Like I just this couple months ago, I had a patient die in the hospital on me, and that was stressful, you know, and then also it's a business too, you know. I mean, patients are patients, but they're also customers, and if you don't have patients, if you don't have customers, you don't get money, and so you have to please people, and sometimes treating the patient is not the same as treating a disease, because patients have expectations, and sometimes they demand that you do things that you shouldn't, like give them antibiotics for a virus, or that's like a little thing, you know, or give them narcotics when they abuse drugs, and so you have to find all these boundaries, and And being in a small town is interesting too, because when I go to the grocery store, I see all my patients. And when I go to church, I see all my patients. And when I have people show up at my front door wanting prescriptions sometimes. And calling my cell phone and sending me texts, hey, Dr. West, I'm in California and I think I have a urine infection. Will you call me an antibiotic? You know, and so it's a very different thing. And trying to find where I can put my boundaries and what's appropriate and what, you know, it's tricky. It's tricky. And then people are sick, and so you get some little old lady that comes in and she's got 45 different problems that she wants to talk about, and she's really like concerned about her leaking bladder, but she's also having chest pain, you know, and then she doesn't want to go to the ER, or her oxygen saturations are like 70% and she refuses to go to the ER. All these things have happened to me. And I'm trying to figure out what I'm supposed to do. It's tough. It's really tough. Yeah.
So how has your view of medicine changed from like being an undergrad to actively in practice?
Oh, tons. Yeah. We all have big ideas, and then we get into reality, and we learn that, you know, it's just like if you know, you see somebody who does something and you're like, I'd never do that, and then you get into the same situation and you find yourself wanting to do that same thing, you know. And then you get into the nitty-gritty of all the details and insurance companies and things that you never had to worry about and never really thought about. You're like, oh my gosh, there's a lot of headaches that I didn't think about. But on the other hand, there are so many rewards that I didn't even think of. Like, I just thought medicine was cool, you know? I'd go and do orthopedic surgery, that'd be cool, you know? And then I could have a private plane. And really, what I enjoy most about my job, I do enjoy sticking needles into people and stuff like that, and cutting stuff. But I really just enjoy talking to people, and most people are so nice, and at least in Morgan, and maybe it'd be different in like a plastic surgery practice, but so yeah. I mean, it's just, it evolves, and you think it's one thing, and it turns out to be, the things that you enjoy, you didn't think you would. It's just like, I'm going to be an orthopedic surgeon, and I ended up doing family practice. These could not be more polar opposite professions, you know, but I like it. And so, yeah, it's interesting. Go ahead.
So your typical 11-hour day, could you just kind of walk us through it? Like, how many patients would you typically see? Do you have a great variety of issues with these patients, or do you have kind of your every day, you can almost guarantee you're going to see 6 or 7 patients with this, and then, you know, you're really out there stuff.
Yeah.
Could you just walk us through your day?
Yeah. So for me, it's going to be completely different from somebody else. And then I'm also in my first year of practice, so it's going to be very different from somebody who's been in practice for 10 or 12 years. Because I'm still trying to figure out how I do this and how I have patient flow and stuff. But I can see anywhere 16, 17 people all the way up to 30. It's really variable because I'm still building practice. And in family practice, every field has its bread and butter. And you have to be okay with the bread and butter. If you could not stand back pain, don't do pain management stuff, you know? and so bread and butter in family practice is going to be chronic conditions, diabetes, hypertension, high cholesterol, and acute things like sinus infections, colds. You know, and so I'll probably see in any average day, 1/3 to 1/2 of my patients have one of those 2 issues. It's just preventative care or maintenance care for chronic disease, and then some acute cold. You know, and I'm okay with that. And if you're not okay with that, you should do family practice. You know, if I do a couple well child checks, I'll do, and then we preserve. We're technically in urgent care, and so we preserve a lot of spaces through the day. So I'm not scheduled out for 3 weeks. I'm not in with my practice yet to that point anyway. But so half of my patients are walk-ins or call the same day. You know, so a couple of urine infections and well, so far today. This morning, I saw a couple people for chronic diabetes stuff, hypertension, I saw a guy who tried to do an insurance physical and failed it because his liver enzymes were up, so we got to figure that out. I took off a skin tag right before I came. I think I stuck another couple needles in people this morning. I don't remember. I think a joint injection. No, I sucked the fluid out of the bursitis. It's typical. Yeah.
I know you kind of already talked about this a little bit, but I was just curious if you could tell us a little bit about, I guess, what made you decide to switch to family practice as your specialty, and also how pleased you are now with that decision.
So I'll preface this by saying that for the rest of my life, just with my personality, and probably many of you are the same, the grass is always greener on the other side of the fence. And that doesn't change when you get into practice. and so I always, one of my patients this morning is a CEO of a great big company, and he has his little key ring with his Ferrari symbol on it, And I'm like, oh, I should have done finance, and some days when I make hard decisions, I'm like, oh, I should have been a pharmacist. Because this is what I do all day is I dispense drugs, and they don't have to make the decision, they just dispense it, and they make sure I don't do something wrong. And which I love my pharmacists. But I think that so you'll have that for the rest of your life if you're like me anyway. But really, I love what I do, and so I went into medicine. I thought I was going to do orthopedic surgery or some sort of surgery. I got into it. So your first 2 years of medical school typically are didactic, they're book work, and then the next 2 are clinical. And during the 3rd year, that's your most important year, and it's your busiest year. There were weeks I worked 105 hours or 110 hours a week. We showed up at 5 in the morning. We didn't leave till 10 o'clock at night, 7 days a week.
That was what year?
3rd year.
Third.
So that's rough. And they have residency laws that guide how much you can work, and many residencies don't follow those. They lie about their numbers, and those laws do not apply for medical students. So they can work you as much as they would like, but you need a lot of exposure, because at the end of that year you have to apply to residency. It's like the beginning of your 4th year. You have 12, 13 months of clinical experience. That's it in medicine. So it's really unfair that you have to apply so early, and a lot of people switch in their residencies. It's really unfortunate. In the British system, they do it completely different. 1 year of undergrad, you go straight to medical school. Medical school is 6 years. And you do 3 years of didactic and 3 years of clinical. Then you choose an internship, either surgical or medical, and then you decide what you're going to do. So you get a lot of clinical experience before you decide what you're going to do for the rest of your life. And so, here's another thing, another trick when you're applying to medical schools and you think you want to do something. Find out how many of their graduates do that thing that you want to do. Because if you go to the University of Utah, you will find that most people, and it's just because of the way the surgery program is at the University of Utah Hospital, it's not very friendly. And so, my surgical experience was miserable. And I learned a lot, but it was miserable. And so most people that go to the University of Utah and think they want to do surgery end up going into either anesthesia or something else. And like in our class, we had over a quarter of the people went into anesthesia, which is weird. But basically it was all the people, not all, but most of the people that wanted to do surgery ended up doing anesthesia instead, just to stay in the operating room, but they just couldn't fathom being that miserable during residency. And different schools, they graduate mostly surgeons or mostly psychiatrists. Cornell is famous for all these psychiatrists that come out of Cornell. And so a lot of it depends on your experience. And so picking that before you go in, that's great. And then just you get into that year and you think, oh gosh, I could do that, or I could do that, or I never could do that. And then by the time I got done with that year, I was like, oh, I enjoyed my family medicine rotation more than any other rotation. And so that's why I did it. Yeah.
What was the cause of the dislike?
Misery?
Yeah. What was the cause?
Because
of the
they were
misery?
working so much, and the surgeons that over it were so mean to them, and it was just a miserable environment. and so I just couldn't see myself doing that. And then my experience at McCady Hospital and the OR there was great. Everybody was happy, and people were nice, and it was not the same with you. And so it's probably a lot dependent on where you go.
Yeah.
You know, if you know, anyway, yeah. Research before you go there. Find out what people do, where their graduates go, and if all their graduates go into psychiatry, or a huge part of their class goes into psychiatry, obviously they have a great psychiatry department at their school. And if you don't think you have any interest in doing psychiatry, that might not be the medical school for you. Or if you think surgery, well, pick a school that graduates lots of people into surgery, because they're going to have a great surgery program, and you're going to have a better chance of getting into a good surgery program, because those doctors that are, again, you need letters of recommendation and all these things, those doctors have good connections at good schools around the country, and because they went to school with those people, and so you'll have a better experience. So knowing kind of what you want to do, it's going to change 50 times, don't worry. But knowing kind of what you want to do will help you pick medical schools as you're applying.
Dr. West, with your extremely valuable perspective at this point, especially being, first year in practice, what would you say a few reasons of why one would want to pursue medicine, and a few reasons why one shouldn't?
So if you don't like pressure, don't go. So there are a couple things. If you didn't like science, don't do medicine. If you really like art, you can do a lot of art things, but if you hate science and love art, don't do medicine. If you don't like people, don't do medicine. You could be a lawyer or something. Because you talk to a lot of people, so you really have to enjoy talking to people. Or you could be an anesthesiologist, I guess, and never talk to anybody.
Or radiology.
Radiology, and you just talk to other doctors, which is fun. Or pathology, and so that's my next point, is that there is something in medicine for almost everybody. Medicine, it's huge. The field is huge, and there are a bazillion things that you can do. And once you get out into practice, it's still that way. I mean, I know. Okay, so I did shadowing during medical school with an orthopedic surgeon who was practicing family practice at the jail, and he loved his job, and he made so much money because he had started up a company. And they contract with jails all over the country, west mostly, and provide family practice and dental service to the jails. And he'd saved the jails a bunch of money, and he lived a great lifestyle, much better than his orthopedic. And the reason he quit orthopedic surgery is because he said, I never had time to do anything with my friends. He was a single guy, but and it's because you work a lot as a surgeon. You work a lot. And so that's what he did. And I know doctors who start little healthcare companies, or I met a guy the other day who's a sleep specialist. He did internal medicine, and then he did sleep specialty, which is a fantastic, boring part of medicine, but highly lucrative. And he does a little bit of sleep medicine in Idaho, where he owns a bunch of sleep clinics and CPAP distributor company and sleep centers, and he lives in Florida on a beach. And he just goes to Idaho maybe 12 weeks or 13 weeks a year. And he makes millions of dollars a year. And I know, so you can do tons of stuff. You can teach in a university, which I think would be awesome someday to do. There's a million things you can do, and that's why medicine's so cool. And so if you just think, oh, I love science, but I could not stand talking to people, pathology would be a great specialty for you. And it's great, like people love it who do it. And so there's a million things you can do. And that's one of the cool things about medicine. There's a place for everybody, I think. Not everybody, but most. Yes?
It looks like we're getting
Out of time, yeah.
close to time. If you can't tell, we came prepared with questions, apparently.
That's
But,
great. That's what I wanted to do.
And one other question I had that is maybe applicable for some of us, but if we asked your wife to rate her experience in medical school versus internship, would she say that she would feel like one was a lot more stressful than the other? Would she say it was pretty similar?
I don't know, that'd be tough. Well, she has her own life, you know, and so maybe that's why she has her own life. You know, so she would, first couple of years of medical school, she was a teacher and a coach. She was working more hours than I was. She was working like 100 hours a week. And now she just coaches, and so she likes that a lot better. But residency was really stressful on me, and it made it hard on her because I was stressed out and I was sleep deprived all the time, and so I got a little depressed.
Was that, did you have the 80-hour work week
Yeah.
thing in place at that point?
Yeah, and we stuck to it mostly, you know. But it's still, here's another thing. If you are a person that needs 8 or 9 hours of sleep, that's going to be tough to find a spot for you in medicine. And you could find it, but it would be tougher because emergencies don't happen at night. Or during the day. They all happen at night. They all happen on weekends. And so my internship year, basically the whole year, I worked a 30-hour shift every 4th day. And then the couple days in between, I worked 12-hour shifts. And so it was constant. And I got really, really cranky. And my wife did not like me. and a lot of people get divorces during that time. We didn't, fortunately, because my wife is a better person than I am. And but that's a tough time. And it's just a different type of tough when you get in practice, because I'm under a lot of stress, so I get a little, you know, cranky and snippy and stuff. But it's better than it was in residency, I think, overall. But yeah. Does that answer the question?
Yeah, no, I guess part of the reason I was asking that is because having had a few different people speak here recently, some have said the residency was just killer, like no time at all. I didn't even step foot out of the hospital for years. And then we had somebody in the life and medicine class, and she was like, yeah, residency is awesome, it's a breeze.
Yeah.
And so it's just, I'm curious to know, what's the deciding factor?
Yeah,
Is it
I
just
think
different
that
residencies? Or?
Yeah, 2-part, and I think the other part is you know, and each person, we make up our own experience. I loved residency. I don't want to. It was the first year, especially the first year and a half, was a lot of work, a lot of hours, really tough. I loved residency. I loved it, and I miss it a lot because there's a camaraderie there and friendships that I made that I'll have these friends for the rest of my life. And we get together regularly, and I talk to them on the phone, and just because you're with them so much. And so a lot of it is just you and what experience. And that's the same with undergrad, that's the same with medical school, that's the same with practice, that's the same with anything you do in life. You determine the experience you are going to have. We all have the life that we really want. Because we work for the life that we really want. And if we don't work for something, it means we don't want it that much. And so we all determine our own futures and how happy we are. So it's just life. And you work hard doing whatever you do, whether it's medicine or not. You know. So, you know, my dad works super hard. He does construction. You know. So it's kind of that way.
Is there anything else you'd like to add? Which I know that I have some other questions for you, but if other people need to leave, if you need to take off.
I do need to take off in a few minutes.
Okay.
Anyway. I got a patient in a half an hour or so. but I'm welcome to stay for a minute.
Okay,
Yeah.
well, let's give him a hand.